I grew up in a time when it was normal to believe what the government told you, what the public health officials told you, what your teachers told you. But since our experience with the recent pandemic, many of us, I think, have become extremely skeptical of our public health officials, the government, and in particular, the media. I've attempted to avoid the topic of the pandemic because there's so many others out there that are really doing a good job following developments from day one of the pandemic right straight through till now. However, I've concluded that the more that we discuss this topic in terms of what our officials knew but didn't share, the better prepared we'll be for the next pandemic. This includes not only the origins of the virus, but the beneficence of the vaccines, the methods used to control the spread of the virus, and the media's influence, both positive and negative, towards informing the public. And I should not leave out that the political aspect of the pandemic played a huge role in all of our lives. And to this day, it frustrates our ability to understand what happened before, during, and even after the pandemic, assuming that we are in the after phase of the pandemic. I want to share a video with you of an interview with former CDC Director Dr. Robert Redfield. Dr. Redfield is someone who seems to speak about the pandemic with humility and certainly respect towards those who, to this day, seem to disagree with his assessment, particularly of the origins of the pandemic. I ask that if you haven't seen this interview, you consider watching it. And please, leave your opinions and viewpoints in the comments section. I believe that the more we discuss what we've endured, the better we're going to be prepared for the next pandemic, as I think we'll be better informed individuals. And now, I'm going to share with you the interview, courtesy of Hill TV, with Dr. Robert Redfield.
An international team of virus experts have said on Thursday that they actually found genetic data from a market in Wuhan, China, that they believe links the coronavirus with animals, raccoon dogs, that had been for sale there. The New York Times reported on that, adding evidence to the theory that COVID-19, their theory, originated from human-animal contact in a wet market.
The genetic data was drawn from swabs taken in and around the Huanan seafood wholesale market starting in January of 2020. This was shortly after the Chinese authorities shut down the market due to suspicions that it was linked to the outbreak of the coronavirus.
Joining us now to discuss is former CDC Director Robert Redfield. Welcome, Doctor.
Thank you. Thanks for having me.
It's our pleasure. So first and foremost, does this new information about the swabs that have been taken that show evidence that these raccoon dogs had the COVID virus change your estimation of what the origin of the pandemic was?
No, I don't think it really adds anything. I think it's important first, they didn't show that the raccoon dogs were actually infected. What they showed was they could have DNA from raccoon dogs on swabs that they also had the COVID virus on. So it's also not unusual for animals, to be infected as opposed to being the intermediate reservoir. For example, you may or may not know in the United States, a substantial number of the white-tailed deer are infected with COVID. Dogs can be infected with COVID. Cats can be infected with COVID. Minks can be infected with COVID. So all they did was show that in the same swab, they had nucleic acid from a raccoon dog and nucleic acid from COVID. So the dogs could have been infected. They could not have been infected. They could have just been in the same space where the virus was. The other problem I have with all of this, and I wish these authors, rather than publish in the Atlantic monthly, they put their data out into a scientific peer-reviewed journal where it could be critically reviewed. I do want to remind people that we have really strong evidence that this pandemic did not start in December, January. It actually started probably somewhere between August, September, October. So I'm still waiting for the authors, and because they're good scientists, they're men of integrity, women of integrity, but the reality is they really should retract their proximal origin paper where they say that was the origin of the COVID, because they're basically 3 to 4 months out of date from when the pandemic really started.
Good point. Dr. Redfield, you were one of a prominent government health advisors who came out and said, what you thought about the possible lab leak origins of COVID, a view that was really highly stigmatized, I think, for a long period of time, particularly in the media, where political figures and other health officials who really just raised the possibility of it, were likened to it was a conspiracy theory, that sort of thing. Now that the Energy Department has made its conclusion, the FBI as well, that they're expressing low confidence, admittedly, but that a lab origin being more likely. I'm seeing people discussing it again in the media. What do you make of this period of time where you were really not even allowed to express that view in polite society?
Well, I think the whole approach, particularly by the leadership of NIH, I've said this before, was antithetical to science. I stand by my testimony that I did recently, and I know Dr. Fauci, Tony, has some disagreement, but he's incorrect. And I did speak with him in January, and Jeremy Farrar, about how important I thought it was that NIH lead a scientific investigation into the two hypotheses, spillover and lab leak, and do it aggressively. So that we can use science to try to understand what the origins of this virus was. And instead, rather than lead an open, transparent scientific debate where both sides were represented, very rapidly within the first week of February, they went to basically totally support the spillover hypothesis. And you've seen that even with the paper, The Proximal Origin, even with the consensus on their phone call, even with a letter in Lancet that referred to people like me as conspirators because I had a different point of view.
We'll just stop there just for a second. That one of the things that has bothered me since day one is the lack of robust debate, even at the local level, even amongst local health departments, even within my hospital. There has been no debate whatsoever on this. And even to this day, of course, we're still wearing masks at my hospital, and that's a whole separate issue. But still, you have to whisper when you talk about maybe what the spike protein might really be doing. And when we're seeing rises in PSA and otherwise healthy men with essentially normal prostates on MRI, it's just not even something that we can discuss when we know that there's probably a very good chance that spike protein, whether it's from the virus or from the vaccine, either way is causing changes in our bodies that we just don't recognize yet because, first of all, you can't research it. It's off limits. So let me get back to Dr. Redfield here.
I will say I expressed my point of view on the White House task force in January, February of 2020. So people knew that I was of the view as the head of CDC that it was a reasonable hypothesis that this came from a laboratory, and both hypotheses should be pursued. It was very quick, though, that the NIH took a very aggressive stance, as did many of the scientists, that the only acceptable hypothesis was spillover. And unfortunately, the media went in. I mean, the article that you started out, it's not even a scientific article. It's a comment in Atlantic Monthly and the New York Times, and yet it becomes major news.
Right, and it's not a scientific article.
A strong bias, in my view, towards trying to promote the spillover hypothesis rather than having what I consider an honest scientific debate where I've always said if people prove that I'm wrong, I thank them because then I learn something. If you prove to me that I'm right, I'm not as thankful because you didn't teach me anything. This should be a scientific debate, and it hasn't been. It's been a geopolitical decision for a single narrative which is unfortunate. And as I said, is antithetical to science.
And Dr. Redfield, do you think that's because, I think what we're all wondering is, do figures like Dr. Fauci, who have been very chief advocates of a certain kind of scientific research that many people are reasonably worried could have contributed to a lab leak type incident with the grant funding by the U.S. government that was done and that research was conducted in Wuhan, China? Is there a fear that some of the government health scientists and their surrogates have incentive to tamp down lab leak speculation because that impugns their funding priorities and their view of what kind of science should be done?
Yeah, first I want to be very clear, because Tony Fauci and I have been colleagues and friends for over 40 years. I do believe that Fauci and Collins are working in what they believe is in the best interest of science. I happen to totally disagree with them. They are strong advocates of gain-of-function research. I'm a strong advocate for a moratorium on gain-of-function research, because I do believe it's very probable that this pandemic was a direct consequence of science. I do think you're right that there's a strong interest in protecting, their view, protecting science, that is protecting gain-of-function research, and thereby trying to shift the debate that this obviously didn't come from the laboratory, this obviously came from nature. And that's really the push. Secondarily, and I don't blame the Chinese lab per se. The reality is the U.S. government funded this work. NIH funded it, USAID funded it, the State Department funded it, and the DoD funded it. So the United States funded the research, and the scientific community, largely in America and Europe, fostered the gain-of-function research, which was the basis for which this virus came. Tony's right that prior to gain-of-function research, the only way new pathogens came in to the human species was spillover. But now, in the presence of gain-of-function research, where you can take a pathogen into a laboratory and change it, then no longer does the species barrier really define the event in humans. It can actually come. And I do believe the next pandemic, and we're going to have another pandemic, and I think it's going to be the great pandemic. I consider COVID a minor pandemic. The great pandemic is going to come, and normally it would come from spillover. It's going to be bird flu that learns how to transmit to humans and then go human to human. But I think the species barriers are very real, but it's much more probable that it will happen because of gain-of-function research in a laboratory and then escape, and then we're going to have a pandemic with flu, which will be much more brutal to the world than COVID was.
Doctor, I so appreciate you saying that you appreciate being told, that when you're wrong, because then you learn something. I'm wondering if, you could share anything that you think you were wrong about at the beginning of the pandemic, now that you're being quite vindicated on some of the larger questions.
Well, I was wrong on several things. I didn't make this decision. The broader scientific community, Fauci and others did, to call this, SARS-like. This virus is not SARS-like. SARS basically came from a bat to an intermediate host to humans, but it never learned how to go efficiently human to human. MERS never learned to go efficiently to human. This virus immediately was one of the most infectious viruses. So what's the first mistake we made? And I was part of it. My colleague, my counterpart, George Gao, who was the head of CDC in China, basically guaranteed me that this virus didn't go human to human. Right? Even though I was skeptical when I saw his first 27 cases, because 3 of them were in clusters, we did come to the conclusion that this virus was also SARS-like in that it only caused disease symptomatically. So I think the first big mistake I made was I was looking for symptomatic infections. And so as a consequence, we told the public health community, look for sick people that had exposure to China, and let's test them for the virus. Debbie Birx and I, by the end of February, said we got that wrong. This virus largely is asymptomatic. And so that changes the entire public health response, because now you can't look for sick people. You've got to figure out another way to diagnose the silent epidemic, and that was expanded testing. So I'd say the first mistake that I made, and many came along with me, was assuming that this virus caused symptomatic infection. And in fact, it didn't. And it really formed the basis of our original public health response. You remember when people coming back at airports, we would screen everybody at the airport and we'd ask them if they were sick. And if they were sick, we'd take them aside and evaluate them. And if they weren't sick, we'd let them go through. Well, we now know that probably 3/4 of the people that get COVID don't get sick if they're younger than, say, the age of 50. Big mistake.
There were also problems with early testing, that the CDC was involved with. You've said we're going to have another pandemic, God forbid, worse than COVID. That sounds horrible. Do you think, given the early testing errors that happened with COVID, would the CDC be better able to gear up in the event of another pandemic so that we don't have the failures with the tests and things of that nature?
Yeah, thanks for bringing it up, because this is another area where the media never got it quite right, okay? CDC's job was to develop new tests for the public health community of our nation, for the public health labs. And I actually think we should have gotten an award because we developed a test within 10 days of knowing the sequence of this virus. And that's how we were able to diagnose the first cases, I think, on January 21st. That test was never flawed. That test never failed. That test was never not available to any health department in the United States. The only problem is you had to send the blood to CDC. Now, people at CDC decided, after the health departments were kind of complaining that they were tired of sending all the blood to CDC, that wouldn't it be nice if we gave them the reagents so they could do their own test? And CDC made the decision then to manufacture the reagents. The second thing they decided, since they were sending the test away from the mothership, they wanted to be very sure that they wouldn't get false positives. So this test was based on what we call 2 primer pairs. They decided to add a 3rd primer pair. Well, that 3rd primer pair wasn't vetted to the degree it should have been. And so when they sent the test out that Thursday, and to validate, it was never used by the health departments because they had to prove that it worked. My phone started ringing the next day that the test wasn't validating. They were getting low-level false positives. And what we learned was that the 3rd primer pair was, the FDA would argue was contaminated. I argued it may have been a design flaw. We know now it was a design flaw. I can't rule out that it wasn't also contaminated. We then removed the 3rd primer pair and went back to the original test, and it's worked ever since and continues to this day. The real problem with testing, and this is really important for the next pandemic, and why does South Korea do so well and we do so poorly? South Korea developed private-public partnerships with the diagnostic companies when they had their MERS outbreak. All right, and so they were in place. We have a CDC that makes lab tests for the 100 or so public health labs, but we don't have a CDC to make lab tests for every hospital in the country or for clinical medicine. That's the job of the private sector. And so what happened was there was no private sector. And BARDA never got engaged to bring the private sector in. The private sector didn't get engaged because when SARS came, they built a test and then SARS went away. And when MERS came, they built a test and MERS went away. So everyone's saying this is SARS-like. The private sector stayed on the sideline. The other major flaw, which I got Steve Hahn to change, the FDA had decided that they didn't want any laboratory-developed test. They want to regulate laboratory-developed tests. I ran laboratories my career, and I developed a lot of laboratory tests that I used to help treat my patients. So we assumed that the molecular labs at Harvard and Mass General, in Seattle, San Francisco, they would all chime in because we published our primer pairs. We published the method. We didn't patent it. We figured all the big, diagnostic labs in the hospitals would go ahead and start providing testing for people. But that didn't happen because the FDA made it very clear that they were going to come down hard on anybody that used a lab-developed test. So that was another flaw.
Dr. Redfield, I want to get you, before we run out of time with you, to just respond to a recent appearance by Dr. Fauci on News Nation's Cuomo, with News Nation's Cuomo. He responded to your testimony concerning the very early days of the pandemic. Let's take a quick look.
No, this should be good.
Well, it's really sad, Chris, that he's wrong on every single account, but you don't need to take my word for it. You take the word for the people. He's saying that the phone call to discuss the possibility that this might have been engineered, that I was in charge of the phone call and I deliberately excluded him because his ideas differed from what he interpreted were mine. Well, first of all, he had no idea what my ideas were because I kept a completely open mind. Secondly, I was not responsible. I didn't include or exclude anybody from the call because the people that were responsible for setting up the call were Jeremy Farrar from...
Now, wait a second. Doesn't he have emails that have been published that showed how much he tried to suppress this information coming out, and yet he's saying that well, it's just it's so difficult to listen to this man. He is quite the megalomaniac.
The Wellcome Trust in the UK, Eddie Holmes from Australia, and a bunch of other very competent evolutionary virologists. So for him to say, and it's sad that he's so wrong, and he's publicly saying that I excluded him. Now, the other thing that's important, he's saying that I excluded him because his idea was different from my idea, and his idea was that it came from a lab. Well, half the people on the call felt it might be from a lab.
So, Dr. Redfield, what do you make of that response from Dr. Fauci?
Well, first, I stand by my testimony. I talked to Tony in January, as I said before, and Jeremy Farrar independently about the importance for us to have a scientific investigation into the two hypotheses and to have a rigorous, transparent investigation into the two hypotheses. And I made it clear, that I, as a virologist, Tony's an immunologist, as a virologist, I favored the lab leak for a variety of different reasons. And I didn't say that Tony deliberately excluded me. I said I was not included in the call. Now, I can guarantee you that Fauci was very involved in who was on that call, and Jeremy Farrar was working very closely with him, as they did for the Lancet letter, as they did for the paper, The Proximal Origin of AIDS. So there's no question. And the other thing I'll just say, within 3 to 4 days, if he had so many people that believed what I believed as a hypothesis, that were so engaged in that hypothesis, within 3 or 4 days, they all changed and they did a consensus report that this laboratory leak was not in the cards. It couldn't have happened. It had to be a spillover.
They all got recruited and put on board.
I disagree with Tony. I'm sad he didn't provide the scientific leadership that he should have provided as the head of NIAID to have this transparent investigation of both hypotheses. He should have put together teams to go after both hypotheses. And it should have been open, transparent, rigorous scientific debate. It didn't happen. Instead, there was a very concerted effort to come to a single narrative. Now, I'm not going to tell you who on the call told me that, that how they went to a single narrative, and I'm not going to say who said that, one of the reasons certain people weren't included like me is they were convinced that I wouldn't agree to a single narrative. But the fact is they came out with a single narrative in 3 days.
So you're saying that the reason, because it seemed like what Dr. Fauci was saying was that you don't know his mens rea, you don't know what he really believed or how he was leaning, but you're saying that you had a conversation with somebody else who was a participant on the call who told you that the reason that you were in fact excluded, and the reason was because you were inclined to believe.
Another member said they wanted a single consensus, and I wasn't there. But I know what Tony felt because we argued it out in the White House task force, and you can read Vice President Pence's book. He even says Fauci guaranteed him that it didn't come from a lab, it came from Spiro. But Redfield felt it came from Spiro, from a lab. It was all discussed within the White House task force. It just wasn't discussed publicly.
So can you give us a sense of what was Fauci saying to you? How was he pushing back against you as you were advocating for?
He said it was a spillover. He said it's absolutely spillover. Go back and watch all his, one thing Tony has that I don't have in those days, he has a lot of media time.
Yeah,
and
a lot of media time.
And go back and play what he said. Okay, go back and play what he said.
He said that this was spillover. I think people are interested, Dr. Redfield, and because you obviously are very knowledgeable about this, and people are interested in kind of what his off-camera response might have been to someone like yourself, who was confronting him with direct factual basis for why you think the lab leak origin was more viable.
Read Vice President Pence's book. He says it very clearly that I said that it came from the lab. Tony guaranteed him that it was a spillover event.
Dr. Redfield, I think a lot of people might say, well, okay, we don't know exactly for sure which of these two hypotheses it is. Maybe policy changes should happen to guard against both of them. You know, there's only maybe so much we can do about open wet markets in China, but if we had them in the U.S., we would close them. We would also maybe renew the moratorium on gain-of-function research, which expired in 2018. My understanding is some exceptions were granted anyway under that moratorium. Dr. Fauci was deposed on this issue and gave some inclination that he might have personally signed off on some exceptions, but now that moratorium no longer exists. Do you think we should re-implement a moratorium on this research like today?
Yeah, I mean, the reason that I've taken the position that I've taken, you know, I just prefer to stay out of the public eye and been there, done that. But I took this position because I feel very strongly that we need to have a moratorium on gain-of-function research. I told you that the great pandemic is coming. I think it's going to come not from spillover. It's going to come from gain-of-function research or intentional bioterrorism, right? It's going to be a bird flu virus that is manipulated to be able to transmit human to human, very similar to what we saw with the COVID. You know, in 2014, that laboratory published that they finally learned how to take their COVID virus and have it bind to the H2 receptor in humanized mice, and therefore it could go human to human. I mean, they did the experiments, they published them in 2014. And now we see that there's a COVID virus, which is, I think, has a number of signature sequences in it that aren't normal. The furin cleavage site, the fact that they use the nucleotide triplet for arginine that humans use, not bats use, the fact that COVID right now can barely infect bats, but can infect humans, should tell you that there's a lot of evidence that this virus was manipulated to be able to be highly transmissible among humans. I think it was done probably as part of a biodefense program that largely was trying to make a vaccine vector that would be used for good purposes. But unfortunately, that virus escaped, and it was highly transmissible for humans. And you saw from the time it escaped, which was probably somewhere in the September timeframe. You remember in September, that laboratory did three things. They changed the management from the civilian to military. They deleted all the sequences of the viruses, and they put a contract in for a new ventilation system. That's about the same time they began to see some illness in the area. So I think that's when the epidemic started. And I do think the gain-of-function research moratorium is something should happen. It shouldn't be decided just by scientists. I happen to be a scientist, but we shouldn't decide this ourselves. There should be a broader debate of society whether this research needs to be done or not. Tony will argue it needs to be done. Collins will argue it needs to be done. I think that debate should happen. And if the answer for society is we need to do the research because the potential good is greater than any harm, then we should figure out how do we do it in a safe, responsible, and effective way. But right now, this research is being done in university laboratories all over the world. And again, I'll go on record, don't like to say it. My parents were scientists. It hurts me to say this. But I do believe that the most likely answer when we get to the truth is that this pandemic was caused by science, not by a natural spillover event.
Oh.
Well, there you have it. And I hope you found that interesting. I think that there are several videos that are out that are quite interesting that I'd like to share with you. Some of them from U.S. Senator Rand Paul and his questioning of people that have been integral in the coronavirus response. So I'd like to share those with you coming up soon. Until next time, please consider subscribing to the channel, and also please feel free to leave some comments below. I enjoy reading them, and I'll get back to those that I can. So I'll talk to you all soon. Take care. Bye.